How do EUS and court guide pancreatic biopsies? Imagine trying to find a tiny needle in a haystack. That's what doctors face when they need to take a tissue sample from the pancreas. Luckily, they have powerful imaging tools to help them do this accurately and safely. Endoscopic ultrasound, or EUS, uses a special flexible tube called an endoscope. This tube has a high-frequency ultrasound probe attached to it. The doctor inserts the endoscope through the mouth, down into the stomach and the upper part of the small intestine called the duodenum. Because the ultrasound probe is so close to the pancreas, it produces detailed, real-time images of the organ and nearby structures. When the doctor spots a suspicious mass, they can pass a very thin needle through the wall of the stomach or duodenum directly into the lesion. This process is called fine needle aspiration or fine needle biopsy. It allows the doctor to collect tissue samples precisely from the target area, avoiding blood vessels and other organs. EUS-guided biopsies are highly accurate, with success rates around 76 to 81%. Plus, they often include immediate evaluation of the sample by a cytopathologist, which helps confirm if enough tissue has been collected for diagnosis. EUS is especially helpful when the pancreatic mass is difficult to see with external imaging and can also be used for pain relief procedures like nerve blocks. On the other hand, computed tomography, or CORT, uses X-ray technology to produce detailed cross-sectional images of the body. For a pancreatic biopsy, the doctor first locates the tumor on the CORT scan. Then, they plan a safe path for the needle to reach the lesion through the skin. The needle is inserted percutaneously, meaning through the skin, and guided by real-time CORT images. This approach allows the doctor to see exactly where the needle is going and avoid vital structures like blood vessels or organs. CORT-guided biopsies are usually done on an outpatient basis and have a low complication rate, around 3 to 6.7%. They are often chosen when EUS is not available or when the lesion is more accessible from outside the body. The accuracy of CORT-guided biopsies is similar, around 81%, but sometimes it can be limited by factors like bowel gas or the patient's body habitus, which can obscure the images. Both EUS and CORT-guided biopsies are minimally invasive procedures that play a crucial role in diagnosing pancreatic cancer and other pancreatic diseases. They provide tissue samples that allow pathologists to examine the cells and confirm if the mass is malignant. These samples also help determine the type of cancer and guide personalized treatment options. The decision to use EUS or CORT guidance depends on several factors, including the location and size of the tumor, the patient's anatomy, and the available expertise. Sometimes, doctors use both methods together to get the best results. Recent advances include new EUS-guided core biopsy devices that can obtain larger tissue samples, which may improve diagnostic accuracy and support more detailed molecular testing for personalized medicine. In summary, EUS guides biopsies from inside the digestive tract using ultrasound images to precisely place the needle, while CORT guides biopsies from outside the body with detailed cross-sectional images to direct the needle. Both techniques are essential tools in the fight against pancreatic cancer, helping doctors obtain the tissue they need to make accurate diagnoses and plan effective treatments. Always remember, if you or someone you know is facing a pancreatic concern, consult with a healthcare professional to determine the best approach for your individual situation.